Welcome to the demo video for our GlucoRx Dual Safe pen needles. Here we will be covering how to use best practice technique to ensure safe and efficient injection. Due to GlucoRx being one of 3 heavy sponsors of the Trend Injection Technique Matters guideline, we have been able to reference the literature throughout. To begin, please ensure you have clean hands and are wearing gloves. Remove the pen cap and roll the insulin pen 10 times in the palm of your hand. Then move on to invert the insulin pen 10 times. Remove the paper seal from the GlucoRx Dual Safe pen needle. Holding the outer cover, push and screw the GlucoRx Dual Safe pen needle onto the insulin pen in a clockwise direction until you feel resistance. Our GlucoRx Dual Safe pen needles have universal fit on all insulin pens. Next, pull off the outer cover. You will notice 2 separate parts to the safety needle, the white body and the inner clear shield. Next, ensure the insulin pen is in the upright position and check the needle flow by expelling 2 units of insulin, also known as an air shot. A small amount of insulin may appear in the clear capsule as a result. This is normal. If you do not see any insulin leave the tip of the needle, please repeat the air shot process. You can then move on to dial the prescribed dose on the insulin pen. For ease of use, we would recommend using the skin fold technique with GlucoRx Dual Safe pen needles. This will allow for you to actively see the needle penetrate the skin's surface and ensure enough pressure is used to activate the safety guards within the needle. To perform the skin fold technique, raise a fold of skin between your thumb and fingers. Try not to pinch the skin too tightly. Make sure you do not grasp too much tissue to avoid raising the muscle. By using the skin fold technique, you'll be able to observe the white capsule flush against the patient's skin. The clear capsule should not be visible during injection. Please ensure this step is completed successfully before administering the insulin dose. For the purposes of this demonstration, we will be using a stress ball to mimic the patient's skin. Insert the needle through the skin at 90 degrees. Inject the dose fully and count to 10 whilst holding the skin fold. You can then remove the needle and release the skin fold. On lifting the insulin pen away from the skin, the clear shield should automatically deploy and lock in place. 2 red marker flags will then show in the capsule as the needle and safety shield have been activated. This is a useful check to determine the needle has penetrated the skin's surface and administered the dose of insulin. Please note, there may be a small amount of insulin stuck in the clear safety capsule or on the patient's skin surface after injecting. This is because of the insulin left in the capsule after an air shot, and we would expect this. The original 2 units of insulin expelled during the air shot could be present at either of these sites. You can be confident you have not underdosed the patient due to holding the needle in position for 10 seconds before removing. Lastly, remove the safety needle by unscrewing from the insulin pen and dispose of safely in a sharps bin. You will notice the safety shield on the connection end of the insulin pen needle has been activated. Please ensure the sharps bin is in place so you don't need to pass the needle from hand to hand for disposal. If you have any further questions regarding the use of our GlucoRx Dual Safety pen needles or the Trend Injection Technique Matters guideline, please do not hesitate to contact either your local GlucoRx representative or our dedicated customer care team. Our free phone number to call is 0800 007 5892.